what your doctor may not be telling you about nausea. I'm Dr. Melissa. I'm a family lifestyle integrative psychiatry, and I like doing things the safe way, the healthy way, but also with supervision and attention. Did you know that nausea is super complex? It's not just because you're pregnant or you're having some stomach bug or infection. It can also be caused by hormone imbalance, inner ear imbalance, or even things like cancer or stroke. So nausea is super complicated. If you have sudden nausea, you definitely want to get help from a health professional as soon as possible. If you've had nausea for quite some time, for weeks, months, years, you want to find some natural ways. Often you've tried a lot of medications or things over the counter. But here are some natural ways that could potentially help you overcome your nausea. Number one, it's definitely a gut-mind thing when it comes to nausea. So you want to make sure that you are relaxed and knowing what those triggers are. Write down the triggers for your nausea. If it's food, smells, situations, or even emotions. Often if you're overwhelmed because of work stress or a conversation you had, you want to be able to find other ways to cope with that anxiety or stress. Number two, ginger is safe, but usually in supplements or teas. Most of the time, if you're having it in drinks, sugary drinks, or in chews, it's more sugar than ginger. So your doctor may not know that ginger needs to be found in at least 250 milligram capsules along with B6, and that's 25 milligrams for B6. It's especially nice to give for pregnant patients who may not be able to take certain medications. Number three, acupuncture. Acupuncture is one of my favorites. It's super safe, and you can even try getting the acupressure spots at home. It's basically found under your wrist between the two large tendons, not where your pulse can be found, but between the two tendons. So you get 3 fingers, it's called P6, and measure it that way. So if you see 3 fingers like this, you're near that spot, and then you can isolate it right there in between those two tendons. When you press down for at least 30 seconds to a minute, your nausea can decrease. Number 4, magnesium deficiencies are usually associated with nausea. So it's important to get some magnesium in. One of my favorites is magnesium glycinate because it's safe and it doesn't overstimulate the gut to get more loose stools, but actually balances it out into your brain, your muscles, and it's easier to deal with. Number 5, peppermint oil is a fun one. You can get it in the form of an essential oil, and you really don't have to put too much on you. You want to make sure it's mixed with coconut oil, or you can put it through a mist. You don't want to burn yourself by inhaling it or putting it directly to your skin, so make sure you follow the instructions. But if you use peppermint oil safely, you can reduce your nausea in about 50% in just minutes. 6, hydration hacks are important. It's important to drink coconut water, not big chunks of cold water where you feel bloated. You want slow, nice, gentle sips so that you don't overstimulate your nausea. And you may want to avoid laying down. That can create worsening reflux. Often coconut water or lemon water is just enough to replete your electrolytes so you don't feel like the world is spinning. Once again, nausea is super complicated. Don't try to diagnose or treat yourself. You need some help and supervision, and that's why I'm here to educate and inform you about the science and the tools to try and to get guidance on at Dr. Melissa's Kitchen. Follow, like, subscribe, comment, and we'll see you next time.